Hey everyone, Dr. Richard Lai here with Study Acupuncture with me. Now, last episode, we went over a case presentation when I was traveling for work to Boston. And this week, we're going to go over the details of that case presentation, over the symptoms, and what we think we should do for this patient in terms of a point prescription. If you didn't get to catch that episode, I can actually watch it with you right here on my trusty little hologram, which shows my YouTube channel here. So let's go down a little bit, tap here.
All right,
and we'll watch this video
patient,
together.
He lost his sense of, well, he has it back more so now, but when he had COVID, during the peak of COVID, he lost his sense of taste. And he says that his sense of smell is also affected, but now he has more so of it, but he says sometimes he doesn't taste the food or it doesn't taste as good as it usually does. He's seeking treatment with me because of his stomach pain. He always says that he has knots in his stomach, that he has stomach pain, especially like right in this upper area here. He is nauseous sometimes as well. He gets headaches. He's thirsty all the time. He chugs water every chance he gets. One weird thing is that his gums bleed a lot whenever he flosses. Whenever he uses the bathroom, he has loose stools. When we take his pulse feels wiry, like a guitar string, literally plucking a guitar string. It especially feels wiry in the middle position. And then when we look at his tongue is red. Look at the middle of this tongue more red in the middle. It seems like his tongue coat is dry. There's like a yellowish tinge to it.
Okay, all right.
So what you gotta do,
get rid of that. So now let's put up on the screen some of the comments that you went over, and then we'll go into the rationale behind some of the manifestations. All right, so first of all, I have to say thank you to everyone that commented. Taking the time to comment means so much to me, you have no idea. So first here, we have Kara X Julian saying that it could be stomach fire, Ren 4, Li 11, stomach 36, and stomach 44. So those are good points actually to use for this. Rathi says, for this treatment, clear heat in the spleen and liver, and says that it's liver and spleen fire. Okay. Mo Howard says liver heat, lung, and large intestine imbalance, wind heat. First week, oh nice. They even put actually week by week what they would do as interventions. So first week I would treat Li4, Sanjiao 5, lung 7 plus stomach 36, spleen 6, and liver 3, and then reassess. I love that. Reassessing after the interventions is so important because you see, did it work? And then you can modify the treatment. If stomach 36 didn't work, if liver 3 didn't work, let's put something in and see if it benefits the patient more. And now Sylvia here, she said, I'm thinking spleen qi deficiency, probably a gan yin or blood deficiency leading to qi stagnation. So by gan, she's meaning liver. Rise of yang and fire in wei, maybe also with a yin deficiency, and being attacked by gan. So wei meaning like the stomach, and then gan again meaning liver. I would first clear the fire and harmonize the gan yang, meaning liver yang, and allow proper qi flow. Then tonify pi and gan, so tonifying spleen and liver. Sylvia would use stomach 44, Li4 and 11, F2, gallbladder 20, liver 3, PC6, spleen 6, E36 meaning stomach 36, Ren 12, bladder 20. Also could use liver 8, spleen 10, bladder 18 if gan deficiency. Hope I used the right words as English is not my first language. Sorry, by F2 I meant liver 2. F is in Portuguese. So that's awesome, Sylvia. Thank you so much. Not even speaking the native language, you took the time to comment and you did excellent. Great job. And then here we have AC and Sylvia interacting with each other. So AC says, my wild guess, damp heat encumbering the spleen. Currently heat is predominant. And it cuts off because I wanted the whole graphic to show, but here's the rest of it. Rationale, sense of taste and to a point smell is associated with the spleen. COVID often being a damp heat pathogen obstructing the flow of qi to the upper part of the body, therefore impairing the sense of taste and smell. Stomach pain, And knots in the epigastrium is explained by dampness obstructing the flow of qi, leading to pain and knots in the epigastric area. Yes. Nausea, dampness leading to qi counterflow, leading to nausea. Unquenchable thirst. Now this one's tricky. Either it's due to more heat being predominant, or what I've seen more often is dampness obstructing the free flow of fluids to the mouth, giving rise to thirst that is unquenchable. Loose stools is explained by a sign of dampness, and if smelly, then it's heat. Bleeding gums, if the blood is bright red. Heat in the spleen leading to erratic blood. If the gums are pale and there's only slight bleeding, then this is bleeding due to spleen qi deficiency, since the spleen is not able to hold blood due to dampness. You're very good, AC. Wiry pulse, this is explained as a wiry pulse is more often than not a sign of dampness as well. Red tongue with slightly yellow, dryish coating. Here we see damp heat. Dryness is either again a sign of heat or the impaired fluid distribution. Now, one symptom is totally not clear for me, the headaches. Here I would need more information. For me, I'm seeing the headaches, and this is Richard talking. I'm seeing the headaches because of the heat. Back to AC. Here I would need more information. Is it because of liver involvement, damp heat impairing free flow to the qi, or directly result dampness, dull headaches with a feeling like being wrapped in a wet cloth? My treatment method, clear damp heat, tonify spleen, help the clear yang of the spleen to ascend, and AC uses spleen 9, Li 11, stomach 36, spleen 6, Li 4, Li 20, and Ren 12. And these points, great points to clear damp heat, tonify the spleen qi, move qi as well, and also for the knots in the epigastric pain. So this actually opens my mind. Now this is Richard talking. This actually opens my mind a lot, actually, because of the connection with the liver, the wiry pulse, and dampness. Now, Sylvia responds, loved it, always learned in this channel, but I have some questions. I'm still a student studying for my exams next month. Unquenchable thirst means it does not go away easily, right? Isn't that because of heat? Dampness wouldn't be like thirst, but not wanting to drink. Very interesting, your explanation. AC responds, yes, actually thinking about it, the unquenchable thirst is more of a sign of heat. Overall, I am also thinking that this case is more pronounced in terms of heat than the dampness. Usually thirst to dampness is pronounced, but the patient will not drink. I was wrong about that, sorry. The pulse, I often see this misinterpreted. A wiry pulse can of course be a sign of liver qi stagnation and pain, totally true, but it is often a sign of phlegm dampness. The wiriness comes from the impaired flow of qi. Hope that helps. And Sylvia responds, interesting, it helped for sure. All right, and so after reading those comments, I absolutely love the camaraderie that I'm seeing. I love to see a beautiful moment like that, especially in the modern world, in this technological world where basically you saw two people from different parts of the world, they're interacting online together and learning together and teaching each other and supporting each other. I mean, like, that's literally what this is all about. Life is about building each other up instead of tearing each other down. And I've been in a lot of different acupuncture Facebook groups, and honestly, even some in-person get-togethers with other acupuncturists. And there are some acupuncturists, not just acupuncturists, but other healthcare workers as well in other industries. And I'm really sorry to say, but some of them are very egotistical when it comes to the healthcare world. And I mean, I understand we work hard, we study hard, we're really confident in our skill sets, but it shouldn't come at the expense of diminishing someone else's flame just because maybe they're newer or maybe they haven't seen that diagnosis before, because not knowing something is not their fault. If we can build each other up like how AC and Sylvia did, and also everyone else who commented, thank you guys for doing that. Thank you for leaving a positive impact. And that's what I'm looking for in the Facebook group that I have that's currently private. It's only for acupuncturists and acupuncture students who want to foster this type of growth, this type of positivity in each other while they're studying for their board exams, while they're getting their foot in the door for their clinic, while they're building their practice. So if you want to join, find my Facebook group. Just search for Study Acupuncture with me. It's a private Facebook group. You need my approval to enter. And honestly, please forgive me because some of you have emailed me saying, hey, I requested access a couple weeks ago and I didn't get any access yet. Please forgive me. For some reason, Facebook groups don't send me any notifications when someone requests to join. So sometimes there's this stretch of time where I don't look at that and I don't check the whole member request area. So I do apologize for that one, but just send me an email and I promise I'll try to be better. Shoot me a DM or shoot me an email if you find that it's getting too long, that you've been waiting for too long, and I will prove you right away. All right, so now let's get into this patient's case and I'll let you know my thoughts on the case. And honestly, based on what you guys have been saying, I'm actually going to bring a lot of new things back to this patient, and I feel like they're really going to get a lot of benefit from it because of your help. So thank you guys for that. Now, our patient is presenting with what? Our patient is presenting with a chief complaint of pain in the upper stomach area. Now, when we talk to each other as clinicians, instead of saying upper stomach area, what we would say is epigastric area. Now, in terms of this, he's saying that he's having loose stools, or at the very least, they're not very formed like they usually are. He's saying that his stomach just feels like it's in knots at times. He says he feels like he has nausea, he has headaches, he's got the bleeding gums. And on top of all that, he has this diminished sense of taste and smell, which started a while ago when he got COVID. It never really came back fully. He also says that he's thirsty all the time. And when we look at his tongue and pulse, his tongue is red with an even redder middle. And the tongue coat is dry, and there's this yellow tinge to the tongue coat. So it's clear from your comments that this patient's presentation has something to do with the spleen and maybe even the liver. So now let's go back to the basics about the spleen, the liver, and other organs and talk about each of these manifestations. So first, let's start with the spleen. So on the screen, I will put all of the functions of the spleen, from governing the transformation and transportation. Even one of the functions of the spleen is that it's affected by pensiveness. Now, what we're going to focus mostly on is one of the functions, which is that the spleen opens into the mouth. And we know that with the spleen, the element that corresponds with the spleen is earth. The earth element has a lot of other correspondences. For example, the earth element corresponds with the mouth. And so this actually makes sense for all of the other functions of the spleen as well, because the spleen, we know, it governs transformation and transportation. The mouth is the first step of that process because it prepares the food by chewing it up and then transporting it down to the stomach and the spleen, where it can go and be digested, where it can be broken down, transformed, and transported all over the body. And of course, all of this happens normally if the spleen is functioning normally. Meaning, if our spleen qi is intact, then our function is going to be intact as well, meaning the mouth's function. The mouth's function has to do with taste. So that means our sense of taste is going to be good. Also, our ability to chew food is going to be good too. So if your patient, for example, is saying that they have difficulty chewing food, this could have to do with the health and status of the spleen. So just to recap all of that, the earth element, it corresponds with the spleen organ. The spleen has a lot of functions. One of them is that it opens into the mouth. If we have good spleen qi, then the functions of the mouth is going to be also good or intact, meaning we'll be able to chew easily and we'll be able to taste our food as well. That means, though, that a loss of taste, like our patient has in this case, could be related to a spleen qi deficiency or something like that. And that's actually in line with all of your comments. So congratulations on that. So now let's actually expand on that concept. So I'll put on the screen here a table, and this table is going to have a couple columns. Column 1, we're going to put our elements. Column 2, we're going to put the organs that they correspond with. And in column 3, we're going to put the sense organ and even the sense that they correspond with as well. And now these organs, they have influence over these senses. And that's actually the reason why I'm putting it in this order, because I want you to appreciate this fact that when you get into the details with your patient, when you're talking with your patient about the abnormalities that they're experiencing with their vision, with their taste, with their sense of smell, with their hearing, there's a relationship between the health and the acuity of that sense with the health of the organ that's related to that sense. In other words, the health of, for example, your vision is going to depend on the health of your liver, which means also that the health of your eyes also depends on the health of your liver. So a healthy liver means good vision, sharp vision, healthy eyes. But if your liver is experiencing, for example, liver blood deficiency, then the eyes are going to be affected because the eyes correspond with the liver. So you could have dry eyes, you could have poor vision. Now, if we relate this to our case presentation, our patient has a diminished sense of taste and of smell. So, like all of you have been saying in the comments, taste has to do with the spleen, and you are 100% correct. And that's because the earth element, it corresponds with the spleen organ. The spleen organ, it controls the mouth and therefore has influence over the sense of taste. Now, on this table, there's also another organ that has to do with taste, and that is the heart. And that's because the heart has a specific function, which is that it controls the tongue, and therefore it controls taste there as well. And so, differentiating between whether your patient is presenting with something more of a spleen root cause or a heart root cause, that's going to depend on the other symptoms that the patient is presenting with. Now, the other symptom that our patient is presenting with is a diminished sense of smell, which is the sense that corresponds with the lung organ. And so this symptom could be coming from a lung root as well. Only though if we see other lung-related symptoms, like for example, a weak voice or a propensity to get sick. And so now before we talked about how the heart also has to do with the taste. So let's go over some of the functions of the heart here. Now here on the screen, I'll put the functions of the heart. One of them is that it opens into the tongue. Now, what this means, when it opens into the tongue, it just means that the heart, it controls the tongue. And when I say control, I mean that it controls 4 things in relation to the tongue. The heart controls the color of the tongue, it controls the form of the tongue, it controls the appearance of the tongue, and it controls the sense of taste that's related to the tongue. And so that means if the heart is functioning normally, then the tongue is going to be normal in terms of its color, its form, its appearance, and of course, the ability to taste will be normal as well. So in terms of our patient though, our patient is presenting with both a diminished sense of taste and smell. So the question is it the lung or is it the spleen? Or maybe is it the lung and the spleen? Or is it the lung and the heart? That's also a possibility because the heart also controls taste. But for the other manifestations that the patient's presenting with, like for example, the pain in the epigastric area, the nausea, the headaches, the bleeding gums, the loose stools, those don't really point to the heart or even actually to the lungs. So most likely the loss of sense of taste and smell is probably coming from the spleen. And I'll put on the screen a table here, which shows you a connection between the lung and the spleen, because they are both, in fact, tie-in channels. All right, so now the patient is also presenting with other manifestations like pain in the upper stomach area, which when you and I have a clinical conversation between 2 healthcare practitioners, we would say that the patient is complaining of pain in their epigastric region. And then we would also share details of our investigation, like we would ask our patient, what kind of pain are they experiencing? And in this case, the patient's saying that they have knots in their stomach. Now, when you take the word knots in the stomach, this word knots, it could be related to a stagnation type pain. When they say knots, that's generally related to stagnation. Now, if you look at the other manifestations that this case is presenting with, like for example, the headache, the thirstiness, the bleeding, even the red tongue, and also the fact that the patient has a wiry pulse, especially in the middle position. This is actually showing us that the patient has some heat in the middle of the patient. And a really simple way to evaluate your patient's pulse is to relate the front, middle, and rear position to the 3 burners in the body. We have an upper burner, we have a middle burner, and then of course we have a lower burner. The soon position in our pulse is the front pulse position. If you palpate, you feel something awry in this area of the pulse, then that means there's something awry in the upper jowl area of the body. Now, in this case, the patient has a wiry pulse in the middle position. Now, this has to do with the middle jowl. What is in our middle jowl? In our middle jowl is our spleen and our stomach. Our spleen and our stomach is in the middle jowl. And our patient is presenting with stomach-related issues, like, for example, the loose stools, the knots in the stomach. Even they have a diminished sense of taste and smell, which before we've connected that to the spleen. And so these are all middle jowl-related problems. And we can confirm all of this through the tongue and the pulse. The tongue presents with a red tongue with an even redder middle. The middle of the tongue, we know that to be the spleen and stomach area. Red, of course, corresponds with heat, so that means there must be some form of heat in the middle jowl. So your pattern could be something like heat in the middle jowl. The pulse also shows us that because there's a wiry pulse in the middle position, and a wiry pulse, we know it's indicative of a liver disharmony, of pain, even phlegm. And so because the patient is complaining of epigastric pain, that must be showing us that there's pain or wiriness in the middle position, in the middle jowl of the body. Now, in terms of the tongue, again, there's also dry tongue coat. There's also yellowish on the tongue. So those are also all signs of heat. And because the tongue coat is dry, that's actually even showing us that the heat has been there for a long time. It's even causing the body fluids to be dried up. That's why there's dryness on the tongue coat. So now the question is, what are we going to do with this patient? So on the screen, I'll put what I've been doing most recently, which is just 5 points, most of them bilateral. For those stomach 34, I have not been doing bilateral. I've been just doing on his left side. So I've been doing stomach 44, which is the yin spring point. We know that yin spring points are really great for heat-related patterns. So we're using this point to clear that stomach heat or clear the heat that's in the middle jowl area. This is the point that's located just on the inside of the web space between your second and your third toes. I've also been using Ren 12. Ren 12 we know is the front mu point of the stomach. Mu means gathering or collecting point. So basically at this point in the body, this is where there's going to be a lot of qi that's gathering or collecting from the stomach. That's why it's the front mu point of the stomach. So for that reason, we can treat the stomach directly because of that. And Ren 12 is very easy to find on your patient. Basically, between your umbilicus or your belly button and your sternocostal angle is 8 sun. Ren 12 is halfway between that. So 8 divided by 2 is 4. So it's 4 sun superior to your umbilicus. All it is a simple halfway point between the umbilicus and the sternocostal angle. The next point we've been using is stomach 21. Now, this point doesn't really have a special category, but it is special in that it's on the same horizontal plane as Ren 12. And so it's very commonly combined with Ren 12 to strengthen the function of harmonizing the middle jowl. And with this one, it's stomach 21, and any points after stomach 18 is 2 sun from midline versus 4 sun, which is basically right in the middle of your abdominal muscle. And then we have Li 11 and we have stomach 34. Li 11 is the hussy point of the large intestine, and Li 11 has a very specific function and a strong function actually to clear heat in the body. So for most heat patterns, you're going to find this point in the point prescription. And this one's really easy to find as well. It's located halfway between your lateral epicondyle of your humerus and lung 5. So right in the middle between those two. And then the last point that we've been using for this patient is stomach 34. Stomach 34 is the Shi cleft point of the stomach. Shi cleft points we know are really useful for acute type pains. And since our patient has been having stomach pain, that's why we've been using the Shi cleft point of the stomach. All right, and so that brings us to the end of this episode. If you want a PDF of the slides that you saw in this video, head on over to my website, which is www.studyacuvithme.com/podcast, and you can download the PDF for free there. All right, everyone, until next time, God bless and happy studying.